Thank you very much, Pat. Hello, everyone. Thanks for joining us on the traditional territory of the Kwanlin Dun First Nation and the Ta'an-Quachin Council. I would like to begin to wish a happy Independence Day to the Filipino community. We're extremely lucky to have such a rich and vibrant Filipino community here in Yukon. Thank you very much for making Yukon a better place, for contributing so much to our community, and for sharing your culture. Happy Day of Freedom. As we continue to move through the second phase of our path forward, I have a few announcements that I'd like to make today about the progress. I'd like to acknowledge the incredible efforts that local businesses have made to reopen and operate safely. I appreciate that there are many challenges as a result of the safety measures in place, and I'm very impressed with the ingenuity of Yukon businesses, owners, and operators. Thank you. Because of the work that they are doing to keep Yukon safe and because of the precautions each and every one of those businesses are taking, we continue to be in a very good position to lift restrictions. Last week, faith-based leaders were given guidelines to support a return to safe worship. This was important, and I hope that even in an adjusted way, Yukoners found comfort in these communities coming back together. We are also seeing people out and about in our communities enjoying local restaurants and recreation facilities again. These are important parts of our lives, and we're all happy to be able to do these things once again. I'm pleased to say that we will be lifting restrictions on bars next week. As of next Friday, these businesses can operate to customers with an approved business operational plan. We are also working on ways to ease the restrictions on long-term care facilities so that people can reunite with their loved ones who I'm sure they are missing very dearly. I'll leave the details to those developments to Dr. Hanley as he can explain how both of these will safely move forward. We are also seeing libraries start phased opening in the coming days, and this is welcome news for so many Yukoners. As we continue to lift restrictions, I must once again remind Yukoners the responsibility that they have for staying safe. I would ask you to continue to be diligent and practice the 6 steps to staying safe: washing your hands, staying home if you're sick, and monitoring yourself for symptoms, keeping 2 meters away from people who are not in your bubble, be respectful and travel responsibly in our communities, do not gather in groups of more than 10 people indoors, and self-isolate if you are returning from outside the territory. The need to self-isolate upon return to Yukon is an order and continues to be enforced. We recently fined another individual for not following that order. Yukoners, we're definitely not out of the woods yet, but we are making huge progress. But we still need to continue to be diligent. The reason we're in the situation right now is because Yukoners at large have been very diligent. And I thank you all for your continuing to practice the Safe 6. Neighboring jurisdictions are still reporting cases. As many as 40 were reported in Alberta yesterday. Haines, Alaska reported its first case this week. In order to ensure that we can continue to protect Yukoners from the spread of COVID-19 into the territory, we have determined that it is necessary to continue to maintain a state of emergency, which was first declared on March the 27th. Extending that state of emergency means that while we continue to move forward and lift restrictions, we can make adjustments and respond quickly if the situation changes. Now, extending this state of emergency does not change our path forward plan, and it does not signal an increased risk to Yukoners. It means that Yukon still has the tools it needs to manage the situation if we need to adapt quickly. The declaration of a state of emergency under the Civil Emergency Measures Act will continue for another 90 days from today. As I have said, we will continue to lift restrictions and move forward as quickly as possible, as long as it's safe to do so. That does mean that more and more people will be allowed to come into our territory, and people will be moving around the territory a little bit more than they have in the past few months. Some communities have welcomed visitors, while others continue to take a more cautious approach. If you are setting out on a local Yukon adventure, please take some time to check with the community and see what they have to say about visitors, and please respect their wishes. While for many Yukoners the warm weather marks the start of camping season, for many more it's a time where major projects and construction are the focus. These are important community infrastructure projects that will continue to move forward this summer. Mining exploration will also be very active this summer. In fact, just yesterday, Minister Ranj Pillay announced an increase in the Yukon Mineral Exploration Program to support companies with exploration projects this summer. These industries are important parts of our economy. They're important parts of our community as well. They create and sustain jobs for Yukoners, and they keep our economy strong. As we prepare for a very different tourism season this year, it's important that we take advantage of the opportunities that are available while making sure that Yukoners stay safe. People coming to Yukon will still need to follow the guidelines from the Chief Medical Officer of Health. Yukoners, please be respectful of people who are being welcomed into our communities. I'd like to also remind people, as I close up my comments here today, that there are supports in place for Yukoners. We are seeing drug-related deaths on the rise and an increase in intimate partner violence across the country. Yukon is not immune to this. Please know that shelter service are available. Community contacts are available if you need to talk to someone or if you have questions about supports. Mental health and wellness services are also available, and I encourage you all to reach out if needed. Please continue to be considerate of the people around you. Respect your neighbors, as we always do as Yukoners. Continue to check in on loved ones and be very kind. Everyone is in a different situation, and we are all in this together. So thank you very much for the opportunity to update you today. Dr. Hanley.
Thank you, Premier Silver. Good afternoon, bon après-midi. You may not feel like it, but today is the last day of school for most of Yukon, except for Teslin, which technically ends on Monday. That usually means, at least in the minds of our kids and youth, the beginning of summer. Only this year, there are no rowdy shouts of students leaving the school grounds for the last time or shouting goodbyes to friends and teachers. But even without those happy sounds, we have a lot to look forward to. Indeed, summer can now really begin. Already forced out of routine, we are now ushered into that time when we can find days to stay up with the sun and get up a little later. We can eat out of schedule and generally throw off the regimes we follow during the fall, winter, and spring of Yukon. But this summer, there are some rules we can't forget and practices we cannot let up on. The Safe Six need to stay, and those are the rules we cannot let go of. This week I received an email from a mum trying to explain to her children why they should stay 2 meters from others not in their bubbles, why they need to stay in groups of 10 or less. Her admonishments were not any easier when those kids were seeing others not following the rules. They're naturally asking, why should we when those kids are not? I understand how hard this is. It's no easier for me to remember to keep the 2-meter distance than it is for anyone else, or to linger long enough in the bathroom to wash my hands in detail and over a full 20 seconds. When else does 20 seconds seem like such a long time? I'm also regularly hearing from those who plead to keep the borders shut and let us enjoy a COVID-free life. Those are hard messages to reply to. If only we could do that and still pretend that everything would be normal and relax our need to be observing these harsh rules. We cannot do that, and I will remind you why. We've all been hearing about the costs of closed borders. There are civil rights costs. We're keeping families apart. We have a tourism industry gone dry and businesses crying out for customers. These are all heavy costs to pay. The balance of risk has shifted so that strictly closed borders are too high a price to pay for the benefit we are seeing in reduced cases of COVID. We are no longer in that state we were in as short as 2 months ago when COVID was a threat we were just getting to know. we were seeing Wuhan and Lombardy overwhelmed with the sick and the dying. We realized how quickly our small and fragile healthcare system could have been crushed. But we watched and we learned, and we put in place the guidelines and measures that we needed to. So we can, at this point, as Canada gains control of COVID, be much more deliberate as we move away from the hammer of border control to the fine-tuning of managed risk. That theme will guide our approach over the next few months, an approach that eases up on enforcement and restriction while closely monitoring the COVID situation both within and outside Yukon. So how much risk can we tolerate? We are likely to see cases of COVID arrive as we welcome more people into Yukon. What are those risks, and what will it mean if a COVID case comes in? We can do a little math, apart from our more formal modelling, and get some idea. At BC's current point in the epidemic, there are about 200 active cases in a population of 5 million people. Let's say there are more cases out there undetected, maybe double or more. For argument's sake, let's round up to 1,000. The chance of a random case of COVID from BC arriving from Yukon becomes therefore about 1 in 5,000. Add to that COVID is not evenly dispersed in the BC population or anywhere, so that people already involved in a cluster or outbreak will be less likely to travel. Add to that instructions at the border to safely space, to avoid high-risk areas, where to go when sick. The risk decreases, so you will literally need hundreds, or if not thousands, of visitors before you would have a single extra case of COVID associated with opening of the border. The risk is not zero, and the risk even now is not zero. It is just a fraction higher next month than it may be now. But let's look at the flip side. Keep in mind that even one unanticipated case of COVID can take us for a long ride. We have seen large outbreaks in Canada related to just one person that spreads COVID to several others at once, and then to more, and so on. We can't take COVID for granted, and we must all do our part to limit its spread and its impact. So even though the incremental risk of COVID introduction is very small, perhaps negligible from BC based on current epidemiology, there's always a risk of COVID getting out of control from even rare introductions into susceptible settings. What are the higher risk areas? Where should we worry about COVID spread? I know there's lots of concern, even resentment, even hostility focused on out-of-territory license plates, that these people transiting through Yukon and lingering too long may be bringing COVID disease into Yukon. Possible, but very unlikely. The recently reported case in Haines has brought home that Alaska is still seeing lots of COVID cases and still working hard to bring this under control at a time when the state is opening up fast. And we are seeing that play out in many other states as well, some of whose citizens may be passing through our territory. But we can take some reassurance despite all that is going on in the US, including Alaska, from the actual data. If you compare active cases to population, the risk that any one person has of carrying COVID is very low. Crunch some numbers and you'll see that the average risk here is probably less than 1% of anyone carrying COVID, often much less. In the unlikely event someone was unknowingly positive, the chance of that individual passing COVID onto others with short, casual interactions is very low. So let people who are passing through pass through. Even a brief stop for gas or a much-needed item is not a high-risk activity. Let's focus on where we need to do our part and where we can get into trouble, should there be that unexpected COVID case amongst us. In Japan, they call it the 3 Cs. Closed spaces with poor ventilation, crowded places with groups of people, and close contact settings like one-on-one conversations. Let's take indoor gatherings or closed spaces. The smaller the space, the longer the stay, the more the people, the higher the chance there is for spread of droplets and aerosols. Sneezing, singing, talking even, amongst lots of people in a confined space, that's a risk. Sharing food or objects, even higher risk. Thus, our limit of 10 stays for the time being, and that's why indoor social gatherings over a meal have repeatedly been shown to be associated with outbreaks. Outdoor gatherings, on the other hand, with lots of room to spread out and lots of ventilation, not so high risk, and very few documented outbreaks. Safer still is to limit the numbers in case someone is infected in that gathering. Thus, our limit of 10 moving to 50 with phase 2. The second C is crowded spaces. We're lucky in Yukon to have so much space, but we should always steer away from crowds, crowded stores, crowded waiting rooms, a spontaneous house party. Alcohol-fueled get-togethers make the risk even higher. And close contact. Healthcare provided to someone where proper protections have not been in place. Distancing, screening for illness, correct use of PPE, correct donning and doffing of PPE are all of the preventive measures. More errors in infection control are made with PPE that is too complicated or where people are untrained. PPE can actually be dangerous. If you don't take it off or put it on properly, you can become contaminated. PPE is one small part of proper infection control. When a patient with COVID is cared for properly, with proper use of PPE, we don't even count that as a contact, as we know that transmission is highly unlikely. Good infection control, including proper use of PPE in a healthcare facility, is very low risk for COVID infection. Overcrowded houses are higher risk. Shelters and long-term care homes, if proper measures are not carried out. In these settings, you have vulnerable individuals. You have opportunities for crowding, opportunities to introduce infection into facilities. But I know that these are risks that are very well mitigated in our facilities in Yukon, and all the right measures are taking place. Schools are not high-risk settings if managed well, and I'm very confident in the measures being prepared for the upcoming school year. Children are low transmitters and themselves only get mild disease. We have lots of time to put in adequate preparations for the next year. As we move through phase 1, we are doing well and we are on track for phase 2. We're even figuring out our timing for phase 3 to recommend to government for further relaxations as described in the Path Forward plan. More on that later. For now, it's up to you, up to all of us to manage and mitigate the risk of COVID. The only way we're going to be able to open up is if we maintain strict adherence to those measures you've heard so often before. Wash your hands frequently or use hand sanitizer. Stay 2 meters apart from anyone not in your bubble. Stay home and away from others if you're sick. Don't gather in groups of more than 10, and self-isolate if you've just come back from outside Yukon or have been in contact with someone who is ill. If you're traveling to a rural community, do so respectfully and only if you're welcome. We don't know when we will have a vaccine against COVID-19. It could be years, and we will have to live with the coronavirus as part of our new normal. We can't let it stop living our lives, but we have to respect what it can do to people and do what we can to make sure we are not spreaders. Following the Safe 6 will help us to do that. I get how the rules are wearing on people. We've been doing this for months, and we have many more months ahead of us. As we open things up, restaurants, summer camps, rec centers, events, there will be challenges and questions, and yes, more parents who have to explain to their children why they must continue to follow the guidelines when others don't. It is those of us who are rule followers who will help to keep others safe. We're learning more and more about COVID every day, and we balance that with keeping the public safe and living our lives. The Premier spoke earlier about the reopening of bars in the near future. Another sign of summer is those outdoor patios, and I know many people are looking forward to that. Just as residents of the Territory's 5 long-term care facilities are looking forward to welcoming visitors for the first time since March 16th. I'm very happy to announce that beginning this week, long-term care has introduced phase 1 of its visiting policy throughout its homes. Residents are now able to identify one visitor who can schedule an outdoor visit with the resident. Staff will work to ensure this happens at a time suitable to both. As with the reopening of the territory and its phases, long-term care has planned a staged return to visiting within the facility and will move through the phases as the situation continually changes. This has been a challenging time for family and residents alike. The decision to shut down completely and early guaranteed, though, that there was no spread within our continuing care homes, as there have been witnessed in other jurisdictions. We continue to move slowly forward, always ensuring that any step we take is in the best interests of the public and does not affect their safety. Everything we do is examined under the lens of keeping us safe. Please, please remember to be kind in everything that you do. That's all for my part in today's update. Thanks, and I'm ready to answer questions. Thank you. Merci. Merci, Chong.
Thank you very much, Premier Silver. Thank you, Dr. Hanley. We'll now go to the phone lines. Tim from CKRW.
Hello, good afternoon. My first question here is for Dr. Hanley. You had mentioned in your statement there about obviously the less than 10 people indoors, and I'm sure you've been asked this over the last few weeks here, outdoor gatherings. Your recommendation, again, as we're heading into the weekend here, is there any specific number in regards to outdoor gatherings, obviously with physical distancing playing a big part?
Yes, thanks, Tim. And you mentioned that just at the end. So physical distancing is the single most important part to remember for outdoor gatherings. We still have the limit of 10 for phase 1. We're still in phase 1, and we do anticipate that being lifted to 50 as of phase 2, which is as of July 1st. So for the moment, please keep those gatherings small and well spaced. Again, all of the other measures at the same time, making sure that if you're sick, you stay home, and keeping the gatherings small, well spaced.
Follow up, Tim?
Yes, this question is for the Premier in his capacity as a finance minister. On March 16th, you said all the COVID aid programs were at about $4 million. On April 6th, you'd said that had been bumped up to $12 million. Do you have an updated figure for us on how much all of the COVID aid programs are costing, both for business and personal?
We right now, if you take a look at all of the different pockets of relief for Yukoners through our territorial government, the total numbers would be just under $40 million, about 37.5 or around there. Now, remember, those numbers are if all of these programs are fully subscribed, which some of them aren't so far. A good example was the sick leave provision as well, because that's going to morph a bit. It started out as a sick leave provision while we were wrapping our heads around testing and getting used to this new normal. Now we have a federal government that's very interested in the program that we're doing here locally and how we can transition that into a reopening type of funding as well. So the reason why I bring it up is, those numbers are total numbers of funding allocations that are underutilized or might be completely utilized. But also there's also the federal government's announcement of $14 billion in reopening funding. And what we've seen with partnerships with CanNor and with Department of Economic Development, with our fixed cost spending, we'll continue to work with the federal government to continue to look at how we fund as we get into the reopening, what the new concerns are, bring our concerns to the federal government to make sure that if there's national programs and policies that Yukon has their fair share of those funding allocations as we design reopening plans, stimulus as we move forward.
Thank you. We'll move now to Gord, Yukon News.
My question's for the Premier. I'm just looking to get a rough explanation on the process that was taken to extend 90 days the Emergency Act.
Do you have a specific question on, or just why we're doing it? So for just up front before you answer, we're extending it for another 90 days. It's not about increased risk necessarily. Again, it's so that we can respond and react quickly and appropriately to the pandemic. As you know from our plan, there are triggers that can trigger us forward. There are also triggers that can move us backwards, unfortunately. So to make sure that we have the enforcement availabilities there through SEMA, the Civil Emergency Measures Act, to protect Yukoners is the most important reason why we're extending this for another 90 days, knowing full well that it can also be terminated earlier than 90 days. Some, but not all, orders extend past the end of the state of emergency, and so what we're doing is just making sure that we have the ability to protect Yukoners if situations change as we move into the summer and into the fall. Hopefully we move forward. Hopefully we move to a situation where we can lift that order and we can lift some of the border provisions. We're not there yet, but we need to extend the 90 days.
Next question, Gord.
All right. I'm curious just on were there discussions in cabinet? How was this decision made?
Definitely a cabinet decision, absolutely. We've been engaging with, and the Chief Medical Officer as well, talking with First Nations leadership, municipal leadership. I have conversations nationally every week as well with the Council of the Federation, the Prime Minister, the Deputy Prime Minister, but also in our finance minister's calls as well. So all of this information feeds into where we are and where we want to be. Also looking at the epidemiology of our neighboring regions. All of those touch points feed into the conversation for us to extend that civil emergency measure.
Thank you. We'll move now to Chris, CBC.
Hi. Question for Dr. Hanley. I guess I'm just interested in trying to figure out how you square allowing bars to reopen next week with your statement that indoor gatherings over a meal is high risk. It seems to me that bars would be potentially an extremely high risk venue.
It's a really good question, and it really goes back to the planning. Bars are, and I did consider bars as higher risk than restaurants, and that's why we wanted to get restaurants underway first, and then that informed some of the planning and recommendations we put into bars reopening. So bars will have guidelines that are actually quite similar to restaurants in terms of occupancy, seating arrangements. They will not be able to host events that involve more than 10 people if they're hosting private events, for example. And the usual measures really around adhering to spacing. So the expectation of bars is that an operational plan has to be approved before they are allowed to open. They are regulated and they are subject to inspection. So we will be keeping a close eye on bars, recognizing that there can be a tendency with consumption of alcohol to perhaps forego some of the intentions and rules that would have been in place. So what we want to discourage is, of course, the tendency to perhaps start to cluster or gather. So the rules will have to be abided by. They are subject to inspection. But if the rules and the plans are followed, then they will. Then that's definitely a manageable risk.
Next question, Chris.
And I guess will bars be subject to more stringent inspection than other businesses?
Well, I can't say that it will be more stringent. I would just say as they're opening, we'll be paying close attention. We'll be thoroughly reviewing, and that's through environmental health. Again, being regulated establishments, that will be making sure that the plans are not only in place, but they tick off all the right boxes of areas that we're concerned about, including, of course, occupancy, spacing, sanitation, and cleaning requirements. And and then, as I say, they'll be subject to inspection. But as to what frequency, that's going to be left to the Environmental Health Department to consider. But definitely, we're aware that there is a potential for higher risk here.
Thank you. Clariane, Radio-Canada.
Oui, bonjour. En français, Dr. Hanley me dire peut-être la justification, la nécessité de reporter les mesures d'urgence pour 90 jours, malgré qu'on commence à déconfiner. Puis, quand est-ce qu'on pourra éliminer quand est-ce qu'on pourra éliminer donc la nécessité pour ces mesures d'urgence?
So the question is, what is the reasons to reconduct the emergency measures, and when exactly will we be able to remove these measures?
Good question, Claudiane. One of the main reasons really is our border provisions. As we look to bubble with British Columbia, we need to make sure that we remain consistent on our border monitoring, and of course the ability at the border to stop folks and to also monitor people moving through to Alaska, or even to provide fines and fees. All of that comes under the Civil Emergency Measures Act. So that would be one of the most important pieces. Is as we open up our border to residents of British Columbia as of July 1st, we still need to be at the border. They still need to answer questions. They need to sign declarations. There's still a process. And so, again, if we're going to move into Phase 2, which starts into July, and our Civil Emergency Measures Act of 90 days starting in March is starting to terminate, then we have to move forward with another 90 days. Again, if we feel or if we find ourselves into a new phase and we still have the Civil Emergency Measures Act, we will always contemplate ending that as soon as we possibly can. But our number one concern right now is the safety of Yukoners, and the Civil Emergency Measures Act is extremely important in that pursuit.
Merci. Prochaine question, Claudiane.
Oui, j'espère en français, mais c'est pas grave. Dr. Hanley, peut-être me dire alors vos recommandations pour les rassemblements, comme mes collègues le mentionnaient, on s'en va dans le week-end. C'est aussi la saison, au risque de me faire chicaner à la maison, c'est la saison des rassemblements d'étudiants, des after-grad parties. Alors, vos recommandations par rapport à ces rassemblements collectifs.
So the question is for Dr. Hanley. Can you please explain in French the recommendations that you have about different types of gatherings that might happen with the summer coming?
Oui, c'est une bonne question parce que c'est la saison pour les rassemblements. Et donc, c'est important de faire une distinction entre les rassemblements sociaux et les rassemblements qui peuvent être pour les autres raisons, les rassemblements organisés. Et par exemple, il y a des rassemblements cérémoniels avec des recommandations en particulier. Et ça dépend de l'occasion et de comment c'est organisé. Et pour exemple, on a quelques applications ou quelques plans soumis pour célébrer les graduations. Et donc, on est en train d'évaluer ces plans. Donc, la différence, effectivement, c'est entre un rassemblement qui est organisé et gouverné et supervisé et un rassemblement plus social, plus spontané. Et donc, les mesures de 10, c'est pour les rassemblements sociaux. Et que si on reste avec les plans qu'on a déjà, c'est les rassemblements qui vont augmenter jusqu'au 50 au-delà du 1er juillet.
Thank you. Gabrielle, Whitehorse Star.
Hi there. Somebody called our newsroom today and said that when they requested information from the COVID info line to ask when their family could visit from Vancouver, they were told the border was going to open sometime in July, but not on July 1st. I'm wondering, and this person was obviously then confused and wondering if flights needed to be rebooked. Is there a planned delay to open the border, or has there been an error in communication there?
No, we're still planning to open July 1st for the BC border.
Follow-up question, Gabrielle?
And Dr. Hanley, you've touched on the fact that border closures might violate charter rights. We saw the NWT say this week that their border closures were considered a violation of charter rights, and so they reopened them. So is that potential violation a conversation that's happening, or has any legal advice been sought on what happens if you're violating that charter right in keeping the borders closed?
Gabriel, I'll answer that question. So we believe that our border control measures are reasonable, and they don't go against the charter. Then they are in place to keep Yukoners safe as a temporary measure and not a long-term restriction. We believe that as we look at these restrictions, they're based upon epidemiology, and we believe that that is the right provisions to enforce a Civil Emergency Measures Act. When it comes to our neighbors across the way in Northwest Territories, we have ongoing conversations with them. Of course, Premier Cochrane, Premier Sigaviktak as well are on the national conversations every week. We also have biweekly conversations with those two leaders, and really at any time we talk back and forth on a nightly basis sometimes. And so we wish them all the best of luck as they deal with their unique circumstances of COVID, and as we continue to follow the advice of the Chief Medical Officer of Health here in our jurisdiction.
And I agree with it, with all of that, and I think it's just important that the important word there is temporary. That we are doing these things as temporary, recognizing, as I've said before, that border closures are not a sustainable option for the longer term. So even as we have the closed borders, we're looking towards the easing. The first step being this BC the BC bubble. And then looking at other ways to gradually undo the heavy hammer, as I said, and work with finer tools. So it's really in that we have done this as a very effective and temporary measure, and now we're looking to what's sustainable and what's reasonable for the longer term.
Thank you. We'll move now to Julien, Aurore Boréale.
Oui, merci. La question s'adresse au Dr Hanley. Je me demandais seulement si les centres de soins longue durée, les phases que vous avez mentionnées, concordaient avec celles du gouvernement, où on pouvait voir des délais entre elles, comme par exemple, là on va amorcer la phase 2 en juillet, si on pouvait voir la phase 2 pour ces centres-là plus tard dans le mois, ou peut-être ainsi de suite.
Long-term care centers going to follow the same timeline that we have for the rest of the different institutions, or is it possible that these centers will go to phase 2 later, for example?
Oui, c'est un calendrier qui est différent que le calendrier en général. Donc c'est un procès spécifique pour les soins de long terme. Il y avait beaucoup d'efforts qui étaient mis pour mettre en place ces mesures graduelles pour enlever jusqu'au certain point ces mesures qui avaient restricté les visiteurs. Donc on continue d'apprendre des autres juridictions, des autres endroits, mais on commence avec cette phase et on va travailler avec les soins de long terme pour les prochaines étapes et quand ce sera logique pour aller plus loin.
Could you repeat
Just
that in English,
yeah,
please?
just to repeat, the question was about the phases of long-term care visitation, and they have built a plan which is not necessarily symmetrical with the overall phases of the territory. So it's really designed to be a staged return to visiting, looking for successes, looking for learnings. Already within a few days, there have been learnings from some of the first efforts of allowing visitation, and so it is really a plan of its own that is not necessarily going to be in coordination with the overall phases of the path forward.
Prochaine question, Julien?
Non, pas de questions, merci beaucoup.
Merci. Thank you, Premier Silver. Thank you, Dr. Hanley. Thank you, everyone, for your time today. We would like to advise everyone that beginning next week, our COVID-19 updates will go once a week rather than twice a week. So the next COVID-19 update will take place on Wednesday, June 17th at 2 p.m. Thank you.